Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Trigeminal neuralgia, also called as suicidal disease, is one of the painful condition which is very, very excruciating. Trigeminal nerve is one of the cranial nerve which will come from your brain, and when trigeminal neuralgia happens, this trigeminal nerve will be hypersensitive and hyperinflamed, giving excessive signals to the brain which will be perceived as pain. I am your Dr.Minal Chandra, co-founder of Epione Pain Management Center, and let's discuss about trigeminal neuralgia today. Trigeminal nerve, like I said, is a cranial nerve, and it will start in the brain and it will divide into three branches: the ophthalmic, the maxillary and the mandibular nerve, and then it starts giving sensation on the face. When this condition happens, that is when trigeminal neuralgia will happen, patient will have excruciating shock-like pain which comes and goes off, and it will be associated with inability to drink, inability to eat. Sometimes there will be eye changes where you will have continuous watering of the eyes. Depending upon which nerve is inflamed, which branch of the trigeminal nerve is involved, you will start getting the symptoms. Ophthalmic nerve is the first branch which supplies the eye of your face, and so the patient will usually present pain, electric shock like pain in the forehead or in the upper eyelids or in the eyeballs. When the V2 nerve, that is the maxillary nerve, is involved, you will start having electric shock like pain in the cheeks, along your nostrils, in the upper lip, and all along your lower eyelid. And if V3 nerve, that is the mandibular nerve, is involved, then you will have ear pain, pain in the mandible, pain in the tooth, in the gums and in the lower lip. So depending upon which distribution the patient is complaining, we divided it into V1, V2 and V3. Now this pain is so severe that the pain will come into succession, and then after 2 minutes again the patient will have electric shock like pain, associated with inability to eat food, inability to drink, and any cold thing that has been taken, like a cold wind or the blow of the AC or the fan or any outside air blow, can increase the pain to a larger extent. So what is the treatment? The most commonly and easily done treatment is the radiofrequency ablation of the trigeminal nerve. It is a minimally invasive procedure done by a trained pain physician in operation theatre, which will take around 15 to 20 minutes. We identify the nerve with the help of specific machine, that is the radiofrequency machine, and we ablate those nerves so that the sensitivity of the nerve is decreased and you start getting decrease in the pain. This procedure is such a wonderful procedure that on table immediately the patient will have pain relief, and you can get rid of this pain which can lead to suicidal tendency. So if you are suffering with trigeminal neuralgia, do not miss out on visiting the pain physician so that they can treat you with radiofrequency ablation, which is the easiest, just a needle technique taking 15 to 20 minutes, and you will be pain relief, making sure that you visit the pain physician who is highly trained in doing a radiofrequency ablation. Thank you so much.